Hi Nathan, good to see you again. Heather, the nurse practitioner student that's going to be seeing to you today. How are you doing?
Good, how are you?
Good. We got your height and weight, your vital signs, your blood pressure looked good. You're still taking the lisinopril, it looked like, from your chart, right?
Good.
Okay. Weight is, you're down a little bit, so following that DASH diet and watching your carbs, because you were a little bit pre-diabetic, so that's good. Good job on that. So I'm going to have you go ahead and lay down. I'm going to do a belly assessment today, mostly, okay? And your circulation also, sorry. So first I'm just going to kind of look at your color, make sure that everything looks pink, normal color. When you were sitting up, it didn't look like you had any dependent, like, pooling of, like any discoloration of your legs. You don't have anything going on like that. Your legs don't like turn purple or ruby red, kind of, nope. And just feel for temperature, even on both sides. I'm gonna feel for your pulses, look for any neck vein, jugular vein distension. Feel your radial pulses. They're 2+. I can actually see a little bit of light aortic pulsations there, which is good, normal finding, not concerning at all. Feel your pedal pulses, good, 2+. I don't see any like ulcerations or edema. A little bit of varicose veins, but that's normal because you stand on concrete for work. Things look good. I'm just gonna listen for any breweries. Your aorta, just real light auscultation, and then your renal arteries, 3 centimeters and lateral of the umbilicus. And iliac arteries, 3 centimeters below and lateral to the umbilicus. Good, I don't hear anything abnormal. I'm going to listen over your liver for any friction rubs, which can indicate some inflammation or tumor, mass, things that would warrant further imaging. Sounds good. And over your spleen. I don't hear anything abnormal. A little bit of belly sounds there. And I would want to finish listening to the abdomen. You want to do this before doing any palpation, because you can stir things up. The right lower quadrant, right upper, left upper. And I just want to hear some normal bowel sounds, not hyperactive, not hypoactive. Bowels have been moving normally.
Yeah.
No concerns. Okay. And then I'm just going to start some light palpation of the belly. Just feeling for any masses, distended bladder, just anything abnormal. Oh, the other thing I would look at with circulation is hair patterns to kind of make sure everything looks normal. There's not any bald spots, which would indicate some poor circulation. And then I'm going to do a deeper palpation of the belly. Everything feels pretty normal. I'm going to have you just kind of take a nice big deep breath and hold it. I'm looking for any muscle separations, any herniations, and then just kind of do a half sit up like here. Yep, and then go ahead and lay back down. You haven't had any history of any hernias or any muscle issues in your stomach? Okay. And then I'm going to palpate the spleen if I can, which would be abnormal to feel that, up under the ribs, and kind of, I don't feel anything. And then I can check for it, like gallbladder inflammation, Murphy's sign. If you push up, same area there in the center near where you're trying to find the spleen. And he should have some discomfort and see some grimacing when I release that. And then I'm going to palpate, I'm sorry, I said spleen, liver. Then I'm going to palpate the spleen over here on the left, which is also should not be able to feel that unless you have something like mono or some disorder. Cannot feel your spleen. Can you take a nice deep breath for me? And let it out. Big breath. Okay, I'm going to try to palpate your kidneys. Okay, while I'm over here, I'm going to assess Bernie's point, the appendix over here. Just kind of push in deep, softly push in, and then just release and watch the face for any grimacing, any signs of pain. Another test for this would be lift your right leg up and just push against my hand. Any pain when you do that? Nope. Okay, go ahead and put your leg down. I'm going to check your abdominal reflexes. T8 to T12 injury would create some issues here, so I'm just going to palpate lines in your belly, and I should see contractions of your stomach muscles. There we go. Okay, that's good. And then I'm going to try to percuss your spleen. I'm going to find the gastric bubble. Right at the last intercostal space. It's tympanic. Okay, and then I'm going to just keep palpating, and I want you to take a nice big deep breath, and it should turn to dull if there's an enlarged spleen. This is Castile's sign. Nope, and that's negative. I don't feel anything abnormal there. And over the lungs, we should hear resonance, and the border of the liver is going to turn dull. And we would mark that when going down from the nipple line to the liver area where it turns dull, which is actually right there. So mark that, and then go up from the stomach until it turns dull. And mark that area, and then that should be 6 to 10 centimeters is normal. Anything enlarged would require some further imaging, trying to figure out what's maybe going on with your liver, maybe some LFTs. And see what's happening, but everything seems normal. I'm going to go ahead and have you sit up, and I'm going to percuss your kidneys. You just tell me if you feel any pain when I do this. I'm just going to put my palm down at your the right kidney's a little bit lower than the left, right at the bottom of your ribs here. Any pain?
No.
No?
No.
Okay. Let me look down my list here, make sure I didn't forget anything. I think we did. Got everything. Yeah. Okay, any questions or concerns? No?
Nope.
Okay, I'll see you next time, Nathan. Thank you.